Minister of Health and Social Welfare, Professor Mohammed Ali Pate, has announced that the ministry is set to launch the first ever State of Health report in the country. And according to him, the report will provide a comprehensive analysis of the status of the nation's healthcare system and outline the way forward for the nation's healthcare sector. He said the forthcoming Nigeria Health Sector-wide Joint Annual Review will serve as the foundation for the report. So tonight let's speak with the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, as we assess the nation's journey toward a healthier, more resilient future and Mr. President's resolute commitment to embedding proactive health measures across our national landscape. Prof, good evening to you, sir. Thank you so much for joining us on Politics Tonight. Welcome.
Thank you. Thank you for having me.
Right. The last time we had a conversation was in March, and I can only assume that a lot has happened since then. But first, how does it feel surviving what some Nigerians call a cabinet shake-up of the decade? Does it mean the president is impressed with you and your activities in the last 1 year?
It is an incredible honor to serve this president, given his vision for Nigeria as a peaceful and prosperous country with Nigeria's people at the center of it. So I'm very, very honored to be on his team.
Right. So let's get to the crux of tonight's conversation. We're in a country where good plans are often unimplemented. I mean, we've heard many things about health sector reform, but how do you actually ensure that health sector development becomes real in the lives of Nigerians?
Well, this is one case example where the president unveiled an agenda, the Health Sector Renewal Investment Initiative, with 4 pillars. And we've been working relentlessly in the health sector to implement that vision, to translate it into reality. The governance pillar, which brings the federal government, states and local governments, private sector, development partners, to orient ourselves to respond to Nigeria's citizens' needs in terms of health, to be more transparent, more accountable, and to have really appropriate regulation for the sector, to do what it takes to improve health outcomes, to promote health, to prevent it, to expand primary health care, and to expand our hospital capacity, our infrastructure, as well as human resources and health insurance. Thirdly, to unlock the healthcare value chain, to begin to produce the things that we need to consume in our health sector while creating and retaining some of the economic value, as well as delivering safe, effective tools, as well as health security, with an underlying theme that we need to digitally transform the health sector, and the Nigerian Digital Health Initiative is one example of that, and to defragment it. Now, a year later, after the president's unveilance of this, with the resources that he has provided, with his guidance, we're at a point where we can take a stock for the first time in the joint annual health sector-wide review, which will take place this week. But it's not just about talking about what has happened. There are facts, there are numbers to back up the performance so that we learn as a federation, how far have we come? How have we done in certain areas and where have we fallen short? Not to pass judgment, but to learn the lessons and double up our efforts so that we respond to the needs of Nigerians. So this week, there are 2 important pieces of reports. One is the Demographic and Household Health Survey, which has interviewed 46,000 households in Nigeria to look at the state of their health compared to 2018 and late 2023, October, November, December. Where are we? And there is good news in that regard. There is also still work to be done. And the second part is to look at the perception of Nigerians regarding the health sector. Last year, we did a People's Voices survey, where 2,500 Nigerians were surveyed in a robust manner. We have a sense of their expectations and their experience. This year, we have a perception survey of 2,600 Nigerians. So we know, for instance, that Nigerians' confidence on the sector and their confidence that government is able to respond to health emergencies has improved. We know that there is confidence in the services that has been provided, almost half Nigerians surveyed. In other areas, there is work to be done. We know that utilization has increased, whether it's diabetes testing, blood pressure measurement, cholesterol measurement, and prostate screening among men. But we know that there are gaps. We've seen decline in women going for mammography. So we're calibrating these numbers to sort of understand what are Nigerians wanting us to do more. And there are several other elements. We also now have a feel for the population health of Nigerians. We know now that there has been some progress in reducing child mortality, that diarrheal diseases has reduced, that lower respiratory infections have reduced by 30%, and that we've got modest reduction in HIV as well as slight reduction in malaria. We've seen increase in immunization coverage. Full immunization coverage indeed has increased from 31 to 39%, although the zero-dose children who had been missed from immunization has also increased at the same period of time. So with the increase in access that we have seen from Nigerians over the last several years, we are also seeing in the last 12 months that the cost of care has increased, which means a lot of Nigerians are also struggling to afford this increase in access. So the idea is that with facts, not stories, not opinions, that we begin to tell the story of Nigeria's health renewal and to hold ourselves accountable. And each state of the federation has a scorecard which we can tell the direction of its travel, whether it's increasing. Take contraceptives. 6 states in Nigeria have doubled their modern contraceptive prevalence rate, and 21 states have had increase overall, but there are some that are lagging behind. So with that information, state governors, their commissioners, their primary healthcare agencies know how to tackle those more. For those who are succeeding, we can begin to learn what are they doing right. The idea is that we are accountable to the Nigerian person, to the Nigerian citizens, and that is the idea of improving governance that the President feels is really key, part of driving this agenda of improving the health and well-being of our population to achieve a prosperous, peaceful country ahead. And we believe that we are on our way to do that. This is just the first year, and there's a lot more that is coming ahead.
All right, Prof. This People's Survey, what exactly was your major takeaway from that survey when it comes to access to health? So, important really takeaways. First of all, Nigerians have confidence, and that confidence has increased from the People's Voices Survey in 2023 to the one that has happened now in 2024, that government is competent enough to deal with health emergencies. The numbers have increased. We have also seen increase in access, 10 to 15% in some cases, in terms of Nigerians responding to the urgency to track and measure their numbers. Hypertension measurement among those that have been surveyed has increased. People go and check their blood pressures because we know non-communicable diseases are rising as a burden of disease. Diabetes. We've seen increase in tests for cholesterol, for instance. But we've seen a decline in women that are going for mammography. And we now have to look at, okay, is it the services that are not there? And finally, an important takeaway is the cost. The increase in access has come at a cost, and the costs have escalated. So cost of drugs, cost of access, which adds to the pressure that we have to expand health insurance. We have seen increase in health insurance from 16.7% to 19.1% in the third quarter of 2024. That's 2.4 million Nigerians. And almost all of that increase is from public health insurance, from NHIA and the state health insurance authorities. But the private health insurance has flatlined, which means we need to do more to expand private health insurance for those who are in the informal sector to revamp this effort, to accelerate the progress. We've done well, but there's a lot more that we need to do to reduce the out-of-pocket spending by Nigerians to access health care. That's an important insight. We're also doubling up in the medical relief program, which the President had approved, to make it easier to absorb the shock of rising drug prices for many Nigerians, particularly the poorest and most vulnerable. Mind you, there are preventative measures that we had also put in place that will accelerate, whether it's vaccination to prevent diseases among children, which is much more cost-effective, or it's in the campaign that is currently underway, Know Your Numbers campaign, that is happening all over the country, where 10 million Nigerians will be supported through the state government, through the state commissioners of health, with support from the Federal Ministry of Health, to know their numbers and control their numbers. Know your blood pressure.
check it. Know your blood glucose, check it, and be able to control it. By doing so, we can keep more Nigerians healthier for longer to avoid the extensive cost of medical care. So these are some of the insights we're drawing from the People's Perception Survey, and it's weaving into the work that we do and that we will continue to do ahead, because we realize that health is a critical ingredient for prosperity in our country, even for peace in our country. And the well-being of the Nigerian person is core to this vision that the President has articulated very well.
All right. So I see that you're hosting the health sector's first joint annual review, along with all 36 states' health commissioners, along with donors and development partners. You know, it's interesting to know that there is this collaboration between the Federal Ministry of Health and the states. You know, over the past decades, Nigeria has seen major attempts to strengthen primary health care and move towards universal health care. Though different reforms, we've had Saving 1 Million Lives initiatives, the National Health Act. And stakeholders would say both initiatives were successfully adopted, but faced political and institutional challenges to implementation and sustainability, thereby leading to the importance of addressing accountability gaps in the health sector. This commitment you've shown to working with state governments in an effort to double primary health facilities nationwide. You're saying you're moving it from 8,000 to 17,000 within the next 3 years. Are we actually on course for that?
We're confident that in the direction that we have taken between the federal government, states, and now local governments, that it is possible for us to hit those targets. You recall that we signed a compact with all the 36 state governors and the federal government, and was witnessed by His Excellency Mr. President under his leadership, and 17 development partners. This was in December 2023. And that compact governs the relationship, including the accountability measures and the provision for quarterly performance dialogue and the joint annual review. So we're precisely implementing that compact by having the joint annual review for the first time. So for many years, we've talked about the fiscal federalism and how it relates to health. But here we are acting in a manner that is consistent with that frame of governance, whereby federal government, states, local government come together, review progress, review learnings, and continue. To sustain it, I believe the instruments are there. There's a legal instrument of the Health Act. This is consistent with the vision of the Nigeria Health Act, which sees a national health system. It's also consistent with the policy approval that we obtained at the National Council on Health in November 2023. It's consistent with the approval of His Excellency Mr. President of the sector-wide approach. It's also matched by behaviors that allows us to think that this is owned. It is not just one arm of government loading up to others. All the 36 states of the Federation have signed up, and they have desk officers that are collaborating with us in this joint effort, because we see that we have to join hands. In addition, we've raised financing. We've got concessional financing, grant financing to complement the 1% of the CRF that is put on the table by the federal government, which goes to the primary healthcare centers. More than 8,000 of them already are receiving those funds on the Basic Healthcare Provision Fund, MPHCD Gateway, which supports them to mobilize the health workers, buy needed commodities, get fuel, maintain the facilities, and we've increased it. And on the insurance side, to expand the Vulnerable Groups Fund, as well as on the NCDC for health security to respond to outbreaks, and for the Emergency Medical Treatment Scheme. Small as the monies are, it's a contribution that the federal government is putting, in addition to what the development partners, International Development Association, has put to back this president's agenda. So with that, we see the elements are in place. Because if you have a plan that does not have the resources behind it, it's fiction. Improving the health of Nigerians is not going to be at no cost. It has cost. The only thing is that
Prof, how do you ensure accountability? And are states and local governments truly cooperative?
Yes, we are seeing that. We're seeing that complementing the federal government's effort. We have increased federal government's contribution, and we're asking them to also increase state contribution to the health sector. And we're going to be tracking that over time. And we're seeing the collaboration between the arms of government really showing that we all own this effort, that jointly we'll have to do this. Now, on the fiduciary system, to ensure the resources that we're putting through this system is used for the intended purposes, we've made decisions on the disbursement of these resources in public, with media present. We've asked the fiduciary agencies in government to keep track, to be sure that no one diverts the resources in the front end, that when the resources are channeled through states to the primary health care centers, the workers out there will use those resources for the intended purposes. We put in a hotline, an email for reports, so that there's more transparency. And the fact that we're coming out to look at performance as well, regardless of how you spend the resources, it should be matched with commensurate increase over time in terms of utilization by women, in terms of immunization. That's the direction of holding us accountable. You cannot hold anyone accountable without good data. The absence of data, in a way, allows folks to be able to get by with stories. But we are now moving in a direction that there is going to be data periodically that will assess how far we're going. It may be risky, because if things don't go as planned, one could easily be attacked by the public. But we're willing to take that risk, so long as we take it that we will learn. If something is working, let's do more. If it's not working, we want to know earlier so that we can course correct. And I believe that's the spirit that even the states are joining us. It's not to cast blame, but it's to really see how we can improve and course correct where necessary in an adaptive manner, so that we improve the population health outcomes for Nigerians. We improve the financial risk protection, and that we're doing so equitably, that we don't forget the poorest and most vulnerable, our women, our children, and the poorest in our society, as we improve the health of all Nigerians.
Honorable Minister, talking about improvements, one thing Nigerians lament is the morale and attitude of many health workers in the country. You emphasize the need for workforce upskilling and recruitment enhancement. What has been done in this regard?
A lot has been done. And first of all, I think we appreciate the hard work of various Nigerian health professionals, some of whom are working in remote areas, in urban areas, some of whom are working in difficult circumstances and long hours. We respect them, and the President appreciates them. And that's why he is the African Union champion for human resources for health and community health delivery. We respect them. There are few cases who may behave in ways that is not consistent with the values of the health profession, whether the doctors, nurses, pharmacists. And for those, we have strengthened the regulatory bodies to be able to review them and take disciplinary action where they are. In terms of the conditions around how health workforce is recruited, the President delegated, in fact, issuance of waivers to recruit health workers to the Ministry of Health earlier this year, which has improved the ability to replace health workers. We doubled the quota with my colleague, now the Minister of Education, to improve the training, the capacity that we have in the health workforce, whether it's medical schools, nursing schools, pharmacy schools, lab technicians, and other community health cadres, so that we have the human resources at hand. And now in his role in education, we look to him to work with us to ensure the quality of those schools is also sustained. We also have seen efforts to revamp the infrastructure in many of the teaching hospitals, cancer centers, under this President in 1 year, unprecedented. For frontline health workers, we set up an ambitious goal to retrain 120,000 frontline health workers in 3 years. Believe you me, more than 40,000 have been retrained. These are frontline health workers with new sets of information, and we'll do more. So that engagement and that respect that has come back into the health profession has allowed us to have the stability to focus on the Nigerian person. What can we do to improve the health of Nigerians? That is the mission that the President set, and that's what all of us are working towards. And we see that with time, the Nigerian person will begin to improve, to experience that improvement. And the perception survey shows that, in fact, about half Nigerians are already confident because of what they see beginning to happen, and will not relent. We're just starting. We'll continue on this path, collectively, federal government, states, including the private sector, to pay attention so that we build a healthier nation.
All right. Prof, I asked the question because consistently the president has said he's focused on leveraging the economic potential of every sector to create jobs and tax revenue for public service delivery. What kind of investment interest are you seeing in the health sector now? And what efforts are you making to drive interest in that area?
We've seen tremendous interest. His Excellency, Mr. President, set up an initiative to unlock the healthcare value chain, to increase the contribution of health sector to Nigeria's GDP. And an initiative was set, and policy measures were defined, regulatory standards and aspirations were laid out, and financing. The incentives have begun to kick in. We've seen the executive order, which reduces the tariff VAT on raw materials and manufacturing equipment to zero for certain manufacturers of pharmaceuticals, of needles and syringes, of nets, for instance, of rapid diagnostic test kits. That's unprecedented. That has been gazetted into law by the Attorney General. We've seen the other element, which is on the demand side, pooled procurement mechanisms, volume guarantees, which we are now designing to see how do we leverage the demand of Nigeria's population to encourage domestic manufacturing. As a consequence, we've seen the domestic industry, the pharmaceutical industry, the Federation of Nigerian Pharmaceutical Industry Actors, FENPIA, mobilizing itself, gearing up and with investment to set up new lines, and soon we'll be kicking off those new lines. We've seen new producers of rapid diagnostic test kits, folks expanding the scope of what they are manufacturing. We've seen external manufacturers, pharmaceutical companies, rapid diagnostic. Almost every week we receive one or two that will be interested to come to Nigeria because they see we are serious. GSK, which left Nigeria last year, we received them last week, and they are now looking at what business model they are exploring to see this market of 230 million that is growing, that will be prosperous with the reforms that have been done by the president. It's a market that no sane business person would like to lose out on. And they're beginning to see a message that we need to import substitute, we need to produce those things, we need to create some of the economic value, we need to create jobs for our youth. Digital transformation, for instance, can create thousands of jobs for our youth. Mobile technology, all kinds of innovations in the digital space. So at least 40 business cases are at hand. And we know that there are some that are putting their resources. A major pharma industry is putting its own resources to manufacture generics in Nigeria. And we're seeing others that are in the multilateral space looking at investable projects that they can finance. So the confidence has ticked up, and that's just the beginning. And it's out of respect for the vision of the president, but the concrete actions that he is taking to say that this government is serious to medically industrialize this country, given our population, and that it will serve not only Nigeria, but the West African sub-region, which is 390 million, and potentially the Africa region, which is hundreds of millions of population who could be demanding for things. So it's really an attractive market, and we're seeing interest from the industry, and we're continuing to pursue that. It's also important for our security.
Prof, I hear you, but at a time of economic hardship, where Nigerians are grappling with how they can afford even the most basic essentials of life, we know we have a health insurance agency, but how do Nigerians actually access it? And what can you tell us about changes in this direction?
So, yes, I mean, things are difficult. But at the same time, this is a difficulty after which there is relief. And the relief is we can see light at the end of the tunnel. And this steady hand of the president will take us to the promised land. And we're seeing that even in the fact that we've added 2.4 million Nigerians through public health insurance within a year. That is a major departure from how we've run this over time. The NHIA, working with the state health insurance authorities, have developed a mechanism that is working well in terms of expanding the publicly covered and insuring population. The Vulnerable Groups Fund, for instance. The recalibration.
What kind of mechanism is that, Prof?
Sorry?
What kind of mechanism is that?
Can you... The Vulnerable Groups Fund is a fund established by law. which basically provides protection for the poorest and vulnerable to access primary health care services. And we're adding on the back of that fund resources to make pregnant women afford cesarean section, for instance, which will help us crash maternal mortality. Through the NHIA, for instance, women who have obstetric fistula are being addressed in terms of surgical intervention at no cost to them. These are vulnerable poor women, at least in 4 major centers in the country. These are things that are already happening. So we're expanding that within a very short period of time. In addition, there are other elements, for instance, to explore how we can provide choice to individuals. Instead of allocating lives to HMOs, how do we allow folks to choose so that the quality, how they are treated, the services that they need, there is some flexibility. Use of technology, for instance, to allow folks to enroll easier to the NHIA to have health insurance through private health insurance, basically, to make it easier for populations to actually enroll. Those are some of the reforms that the NHIA leadership is undertaking right now, and I believe that with that and with the mandatory health insurance that has been enshrined by law, we shall see faster progress in Nigerians expanding their participation. And the larger the risk pool, like any insurance, the more protection for the population. And with that, it will affect the supply side, because then more people will afford care because they know they don't have to face the cost. But at this moment, while access has increased, we also are very conscious that many Nigerians are hurting because of cost of care, and we're trying to bring that down. That is the nature of this reform that is adaptive. We learn, we adjust, we learn, we adjust, but with a focus to improve the access to quality health care, to improve population health outcomes.
All right. Prof, let's take a break. Mohammed Ali Pate, Coordinating Minister of Health and Social Welfare, is my guest tonight. And tonight we're assessing President Tinubu's healthcare agenda and delivery. Prof, thank you so much for staying with us on the program. You know, many Nigerians were surprised when the new malaria vaccine landed in Nigeria recently. So tell us tonight, are we truly at the end of malaria in the country?
I think the story of malaria in Nigeria is one that is decades long. And malaria accounts for a significant burden of morbidity and mortality, diseases and death, especially among children, and with impact on pregnant women as well as adults over time. But there are many tools to address malaria. And for a very long time, we had a stalemate. We are controlling it, but we are not on a path to eliminating it. When we came, we had an effort to rethink malaria elimination in Nigeria. This was in May. We brought the world's renowned experts in Africa and also globally, and our own practitioners here in Nigeria to look at the malaria program. And we saw various tools that are available, bed nets that are treated, which can work in reducing the spread of malaria. Case management, the treatment available, the testing to differentiate who has it, who doesn't. The interventions like seasonal chemoprophylaxis, where you give children twice annual treatment that prevents them from getting malaria, and that works, but has not been taken to scale. Intermittent therapy for pregnant women, which also prevent them from getting malaria, that can give them low blood, anemia, which can affect their children. And then the exciting development of a new malaria vaccine, not only one, but actually 2 malaria vaccines. These tools in combination, when layered one after the other, can help drastically change the direction of malaria in our country, as it has done in other countries. But remember, countries eliminated malaria even without a vaccine. So vaccine is a potent tool, but it's one more tool to be laid on the back of several other interventions. So we set up a malaria elimination task force, which is now part of this sector-wide effort that takes the view that the approach we take in Zamfara is going to be different from the approach we take, let's say, in Akwa Ibom, because there are different topographies, different vector ecology, and different population. Or even Lagos, a very urban center that has one of the least incidences of malaria, despite its large population, but because there's a lot of case management. So the subnational tailoring emerged as a key theme. And with that, then mobilizing the resources so that we can execute some of the development partner resources, US government, global fund, but bringing in also our own concessional financing, whether from Islamic Development Bank or from the International Development Association, so that we forge ahead faster to accelerate malaria elimination. So yes, I think it is possible for Nigeria to accelerate the rate of control of malaria. Over the previous 5 years, we've had some decline of malaria, but not good enough in my own estimation. And we're also being challenged not only by the population of people, but also by climate change. Malaria had intensely seasonal dynamic, but with climate change, with the rain pattern that we're seeing, particularly in the northern parts, the seasonality of malaria is becoming less and less intense, so that you have malaria in November, in December. And that has implication what is going on with the climate. So we're looking at that holistically to double our efforts. The advent of the malaria vaccine, and I'm so pleased that our partners felt that, in fact, we should have those doses that we have received. And we're going to roll those out in Kebbi and Bayelsa states, 2 states, so that we see how best to roll this expensive vaccine, because it's not cheap. Someone else pays for it. Educate our health workers to understand how to administer them. Engage with our communities to appreciate how many times and the segment of population, see the impact, and plan so that we don't lurch into expanding the new tool when the systems may not be ready to accept them. And we do know that there are much cheaper, very effective vaccines against things like measles that some parents still are not bringing their children to be immunized. They are much cheaper. Things like diphtheria vaccine that are much cheaper, and we saw outbreaks of diphtheria. So the issue of vaccination is one that we're being very thoughtful in how we organize it and how we introduce it. But it's a potent tool that we are considering in terms of how we scale it up. But even without the vaccine, there are other tools that we can use effectively to accelerate our progress. Countries like Cape Verde, many countries like Egypt, they made so much progress in malaria elimination even before the advent of vaccines. So environmental measures, larval source management, for instance, those are all ways that collectively, and I believe that we would have that ability as a country to converge on this deadly ancient disease and end it. But it will take time, it will take effort, it will take a lot of partnerships. And
absolutely,
later this week, the Nigeria End Malaria Council will meet to look at these various plans, including our private sector leaders like Alhaji Aliko Dangote and many others, that we want them to jump in and complement government's efforts so that Nigeria gets closer to ending malaria.
But Prof, holistically, do we have the vaccine production capacity to support this and other interventions moving forward?
I think the combination of tools, we have a repertoire of tools, and we'll tailor them to particular contexts. The cost of the vaccine, so far, it's been borne by global partners. But the vaccines will have to be purchased. The resources will have to be appropriated. And it's considerable resources because it's provided free. So working that out in a way that is rational, because we can buy a vaccine, and if the population do not accept it, it may end up being wasted. We don't want that to happen. If the health workers are not ready, they may not apply it the way it should be, and we may not get the benefit of it. And remember, the vaccines are one tool, an important tool, and we're excited about it, and we're introducing it into Nigeria, but we're doing it in a very thoughtful manner, taking into consideration a whole range of issues, while at the same time optimizing bed nets, increasing the coverage of treated bed nets, expanding seasonal chemoprophylaxis, doing better in terms of case management, and testing people with fever to understand who needs to be treated and who is not. Thinking about things like resistance that is in our country by the parasites against some of these measures that exist. Intensifying, let's say, production of the bed nets. We have the largest bed net manufacturer coming to Nigeria now to manufacture, all within the last 1 year. They are trying to set up the firm in Lagos to be able to do that. Those are all measures. So think of it as a repertoire, a toolbox that has various tools, of which vaccine is one more tool. And that we need to bring those tools and tailor them to particular contexts. Kebbi, very different from Bayelsa. How do we adapt the various tools, not just vaccines alone? Even where you have the vaccines, you need bed nets, you need seasonal chemoprophylaxis, You need case management. You can't just stop because you have a vaccine, because the vaccine is for an age group. Yeah.
So, Prof, before I take you up on the readiness of the health workers, I mean, putting into consideration regulation, studies, research, efficacy, when can you confidently say that Nigeria would have what it takes to produce these vaccines locally?
I think you'll be surprised to hear that within 12 to 18 months, we expect at least one entity to be able to get us a bulk API and have vaccines packaged, filled and finished in Nigeria that we can administer them. They have license with key manufacturers from India, from Indonesia. There's a second one in Lagos that is advanced in terms of their preparation. But as you know, vaccine manufacturing is not one that you just do it off the shelf. It's not like cooking food or even manufacturing pharmaceuticals. It's a complex biological. The safety and the efficacy have to be maintained at the highest levels. That's why we're pushing NAFDAC as a regulator to also strengthen its hand so that it regulates effectively what we produce. Because we don't want to rush into manufacturing something that we cannot say is world class in terms of its safety and efficacy. And the quality, that's why we're diligently pursuing that as well as encouraging the private sector to set it up. But there are other molecules, let's say, that are easier to produce, pharmaceuticals, rapid diagnostic test kits, or even medical textile. And those also require a good regulator, and we're getting on that path. But the vaccines are ones that are slightly more complicated. So the fill and finish capacity, I expect that in 12 to 18 months, we should be able to have really a robust plan. That will be a major leap for us. And we will continue to expand because what we produce here will also benefit other countries in Africa. And hopefully, in the decades to come, Nigeria can produce even for northern countries. Who knows? That is all possible. But we are committed to doing that.
All right, Prof. So is it a one-time jab or multiple doses? And when you say it's for the vulnerable, is it just children or children and pregnant women and the elderly ones?
At this stage, it's for children. And it's multiple jabs. And that's why how you synchronize it with other routine vaccines, how you train health workers to be able to do that, for parents to come, how you keep the data, how do you do the pharmacovigilance after you've introduced it, because it's a new vaccine, which we are introducing into our country at the scale that we will have to. That's why we're being very thoughtful about it, to ensure safety, but also to get the outcome that we want, which is to stop this disease. But it's not a magic bullet. It's not you take one vaccine and that's it. That's why we have to also keep in mind the other tools that are necessary. All of this requires investments, and the resources have to be mobilized. And we're working very hard to ensure that we begin to mobilize these resources, but it will take time. Yeah.
All right, Prof. You had a meeting with GSK recently. What was that meeting about?
Well, you recall last year, by August, September, there was a whole lot of noise out there that GSK is exiting, Sanofi is exiting. Well, the president initiated an effort to get us online for import substitution, to domestically manufacture products, to optimize, to use our markets, to really capitalize on this volume that we have. And an initiative has been put in place. And we took concrete steps with the executive order that he signed, with the incentive that is in place, with the effort to improve the regulatory framework. Any business entity knows that Nigeria is a market that you don't want to bet against, because we are going to get through these difficulties of this period. And JSK asked to come, and they discussed with us, and that what was framed as exit was really a business decision looking at their business model, and that they are now exploring what that means for them in terms of the business model that they can use to ensure that their products are still made available, even if manufactured by a contract manufacturer. And that's welcome. And we're open to all those who want to invest in Nigeria. We're a large market. At the same time, we do know that we have local industry players who are ramping up their capacity, augmenting, for instance, to be able to produce beta-lactams in Nigeria. Because if they do, they will make profit, They will create jobs, and they will allow us to have the products that we need. And it should be a lot cheaper than what we import from elsewhere. So that's the implication of the policy direction that the President really had. And we are following that diligently.
So, Prof, I think people have noticed that in the last 1 year, we've not seen the typical slate of doctors and nurses strikes. Is there a reason for that?
I think nobody gets into the health profession if they don't have an intent and desire to serve others. So it's a self-selected group that we have in the health profession, whether doctors, nurses. It's not the pecuniary monetary incentives alone that keeps health workers working in difficult circumstances. They enjoy to make people's lives better, to prevent suffering, reduce pain, to save lives. And in the last 1.5 years, we've seen a president who has responded positively when issues regarding workers generally, but health in particular, he has been responsive. And we've worked with them to ensure that first we work as a team, and that we re-establish this atmosphere of mutual respect, and that we lay out issues and constructively dialogue on them, and that we agree on some, and where there are difficulties we disagree and agree to disagree. And with that spirit, we're earning each other's trust. And there are challenges. Some of those challenges are long-standing, 10 years, some more. But NMA, JOHESU, PSN, laboratory scientists, there is an openness to discuss issues. Because so long as we keep the health of the Nigerian person at the center of our attention, it's not what one professional group or one professional group wants, it's the health of Nigeria. And we are all involved. And it is that spirit, in a way, that has stabilized the sector, even among resident doctors who sometimes have difficult issues that they deal with. And we try to meet them up. And they've been responsible. And we appreciate it. And we don't take them for granted. We don't take any worker for granted. It is that spirit that has allowed us to stabilize the sector. And we will continue in that direction. And we call on all health professionals to respect this attention that the President is giving to the sector. And whenever issues arise, let's resolve them. And we appreciate entities like JOHESU and NMA and MD Khan, who have been dialoguing with us on sometimes very difficult issues, but without really downing tools. Because when we down tools, it's Nigerians that suffer. It's women in the rural areas. It's accident victims. It's children that will die needlessly. Yeah.
We need to go, but quickly. I mean, tonight you said a lot. And from our conversation, it's clear that there is a framework, a pathway, and a vision. But overall, you know, most administrators simply conceptualize and implement what appear to them as good ideas. But those ideas may not be what the people need. Is there a place for Nigerians to help shape health policy? How do you ensure the Nigerians' actual healthcare needs are being met by your policies?
Yes, that's absolutely correct. And so this agenda that we laid, in line with the people-centered orientation of this president, we did the People's Voices survey to listen to what Nigerians actually are experiencing and what they want, what the needs are, before framing this agenda that the president unveiled. And this year, again, we took a pulse and will continue to do so. The civil society actors, a diversity of them, whether the Health Sector Reform Coalition, whether the UHC 2030, and many other civil society organizations, we've engaged them in multiple dialogues because they're the interlocutors between the people and the government. And we listen to them and we engage them. And they have made constructive contributions over time, alongside private sector. That is part of enhancing the governance of the sector. So yes, Nigerians' voices are being heard. And Nigerians will continue to be heard. And civil society as interlocutors, we have an open door policy. We engage them because it takes all of us. It's almost a movement that is required to ensure that we have a healthier Nigeria, and we are pursuing that. So yes, we will not cook up agendas that are disconnected from the needs of Nigerians. Whether it's
Prof.
Governance,
Professor Mohammed Ali Pate, Coordinating Minister of Health and Social Welfare. Thank you so much for your time with us tonight. We sincerely wish you and your colleagues at the Ministry of Health the very best in actualizing the dream of the President for the nation. Thank you so much. Please have a great evening.